to you, Jen.
Great, thanks, Rob. My internet is telling me that it's unstable. So I'll, if things start kind of glitching, just put something in the chat and I'll watch for that. And if I need to, I'll turn my camera off. Sometimes that helps. So I'm just going to bring my update up in front of me so that I can read through it. And so welcome, good evening, everyone. Thank you for joining us. Rob already introduced me. So I am Jennifer Cornell. I'm the Director of Long-Term Care for the 3 Grey County homes, Grey Gables in Markdale, Leigh Manor in Owen Sound, and Rockwood Terrace in Durham. So we met last virtually on June 18th. And since then, we have provided newsletters and updates via email, MailChimp each week. Since that time, there have been further directive updates from the province, from the Ministry of Long-Term Care and Public Health. Our infection control, staffing, and PPE strategies continue in each of our homes. And as of today, there continues to be no positive cases of COVID-19 in any of our 3 homes. The purpose of our call tonight is to provide an update and to reassure you that we continue to do everything that we can to keep your loved ones safe while coloring it for them every day. During this call, I will give an update on a number of things: the surveillance and detection testing for staff, the reintroduction of services, including hairdressing, foot care, social worker, occupational therapy, updates to Directive number 3, which is primarily updates regarding visiting in long-term care, an update on Clinic Connects, and I'll tell you about that, and then we'll do any frequently asked questions, or whether they're frequently, I don't know. We'll answer questions. So the situation in long-term care continues to be stable in Grey Bruce and also within the Southwest region. We are all working through the phases of the community reopening, so stores, playgrounds, beaches, and so on. The homes are also reintroducing a variety of services and programs. We must keep in mind, though, that there does continue to be community spread of the virus, and we must remain vigilant in our strategies to prevent infection. These strategies are our first line of defense in stopping the spread of the virus getting into the home. So I'll just give you a quick overview of those strategies that continue to be in place. So active screening for every person who comes in and out of the building. This includes every team member, every service provider, which is X-ray services, blood work, and every visitor, essential visitors, and soon indoor visitors. This active screening includes documenting the visitor or the staff member's name, contact information, taking temperatures, answering specific screening questions, as well as on-the-spot education on donning and doffing the mask and any other PPE that's needed, hand hygiene education, and respiratory etiquette. As I've mentioned, this is a very important step in the protection of our residents, our staff, and visitors. Staff are only working in one facility. That continues. We continue to minimize the movement of staff from home area to home area within the home. All staff and visitors in the home are wearing surgical masks at all time. All new residents moving into the home are tested for COVID-19 and are isolated for 14 days, and they're also tested at the end of that 14-day isolation. The leadership teams in the home continue to provide support and leadership 7 days a week. Plans are in place in all 3 homes to quickly isolate a resident if needed. Plans are in place in each home to quickly move into full outbreak protocols if needed. And we continue to monitor our PPE supply and report our inventory to the province. My update says daily, but I think that's moved to twice a week. So staff interval testing. There has been an update provided by the province regarding surveillance and detection testing for all staff. This testing is another tool in our toolbox to assist us in monitoring and preventing the virus from coming into the home. In June, we had a prevalence study of testing that was required by Public Health, and we had a 100% compliance rate. The interval surveillance testing is a requirement of the Ministry of Long-Term Care and Ontario Health. It's not a program directed by Public Health. The July testing had approximately a 50% compliance rate. The updated direction that came from the province states that all staff should be tested twice per month. So in that spirit, we have struck a team to develop a testing strategy and policy to support staff in being tested. The focus of the strategy is to make the process of being tested as convenient and accessible as possible, and our goal is to have a high compliance rate. We have staff testing dates scheduled for July and August, and I had my COVID test yesterday. I went to an assessment center. This allows me to safely visit the homes and also allows me to have a true understanding of what it is I'm asking for all staff. I will continue to be tested every 2 weeks. And if you're interested later on and we have time and you'd like to know the experience, I can tell you my swab story. And it's not a bad one. So reintroduction of services and programs. We have been reintroducing a variety of services and programs in each home, and each home will be at a slightly different stage depending on their unique circumstances. And that might be their physical layout, for example. All 3 teams were very creative over the past number of months in finding unique ways to provide services to the residents. The homes have welcomed back adapted versions of hairdressing, social work, foot care, and chaplain services. As mentioned, one home may have had the service provider available to them in person, while another home was providing that service virtually. Small group activities continue to happen in all 3 homes. They are small groups of residents from the same home area and include programs like bingo, cocktails in the garden, crafts, and gardening. In June, we started some activities outside with residents from different home areas. These are closely monitored as it is important to have people physically distanced from each other. These have been very well received by residents. Weekly virtual church services are also offered. Garden strolls, ice cream truck, and mobile spa carts are other examples of adapted recreation and program opportunities. Outdoor activities continue to be a highlight for residents and include barbecues and picnics on the property and outdoor concerts. Directive number 3 from the Provincial Medical Officer of Health remains in place and was last updated on June 10th. So we went over those updates on our June 18th call. On July 15th, an updated guidance document came from the province titled Provincial Update to Visits at Long-Term Care. It outlines a revised approach to visits and is a change from the previous provincial direction that we discussed on our June call. So here's, I'm sure, what many of you are really interested in better knowing what our directions are. So outdoor visits no longer require a COVID-19 test, and 2 visitors are now permitted to visit at one time. On July 22nd, indoor visits may resume as soon as the home has established procedures and protocols for infection prevention and control measures, have a scheduling system in place, and the home is not in an outbreak. So our teams closely reviewed the guidelines from the province and consulted with our clinical teams. And as I said, there was an update sent out Monday or Tuesday to just clarify when we would be opening the doors to indoor visits. And so we determined that the best way to support indoor visits was to use a similar approach as the outdoor visit. So effective Friday, July 24th, which is tomorrow, each home will have set up designated indoor visiting areas. This will allow residents to have a scheduled visit with up to 2 visitors once a week. Each visitor must attest to having a COVID-19 negative test within the previous 2 weeks. A surgical mask that we will provide must remain on throughout the visit, and physical distancing must be maintained. Infection prevention and control education will also be provided to each visitor. For the beginning of this initiative, we are continuing to have the following restrictions. Visitors must be 18 years or over, no pets, no food and drink, with the exception of hot weather protocols. And so there was some really hot days with our outdoor visits, and we did provide some hydration and gave some education on how to do that safely. So you can get that education at your visit. So we are providing hydration on those really hot, humid days. Gifts and care packages must still go through the 24-hour quarantine or hold process before it's delivered to your loved one. These restrictions will be continuously evaluated and revised as we work through the process, where we are working on a strategy to lower the restriction on around children, and may have a different approach for the 12 and under and the 12 and over crowd. We're also working with public health around strategies to allow pet visits. We had great success with the online booking tool, and my update says we're currently in the process of updating it, but it has been updated and to include the indoor visits, and that tool is now live today and available to be booking indoor visits. We continue to develop the Designated Care Partner Program, which is supported by the updated Provincial Visitor Policy. The Provincial Policy provides definitions for essential visitor, essential caregiver, and visitor. The Designated Care Partner meets the essential caregiver definition. Our focus with the DCP program is to support the psychosocial and emotional well-being of residents, and we feel this program will allow us to start slow and grow, and will be separate from, but complement the indoor visiting. We are currently seeking input from the resident and family councils to assist with the final details of the program. Once the policy is finalized and approved by all of our stakeholders, so that's residents, family representatives, staff, and public health, we will be moving forward with the DCP Pilot project. This slower approach will allow the homes to evaluate and implement the necessary changes to ensure everyone's safety and continued success. The pilot project will be a small trial. It will be a small group of residents choosing their 2 designated care partners. The designated care partner will receive an education package and training on infection control practices, PPE use, review the guidelines and parameters. There's a commitment and responsibility section. The home will work out a strategy to slowly introduce a care partner visit based on clinical and public health input. For example, how many partners can be in the home at any given time. And we're going to have check-in and evaluation of the process as we work through our pilot. The visiting policies and initiatives will be closely monitored and evaluated and balanced. Oh, can everyone still hear me? Because I'm getting a note that says my internet is unstable.
I can hear you clearly. You're getting a little choppy on the picture. But...
Okay. So maybe I'll just turn my camera off for the update, and then I'll turn it back on for the questions. And I lost my update, so let me just, sorry, thanks everyone for your patience. So these policies and initiatives are going to be closely monitored and evaluated, balanced against what is happening in the community around us. The Grey Bruce Medical Officer of Health uses a dimmer switch analogy. So if there's an outbreak in the home, we can turn the volume down or dim the program. And if things are stable in the community, we can turn the volume back up, turn the lights back up more brightly. So those are the protocols that, the balancing protocols that we're going to look at. I will also add that there is initial support from public health on this program, and they have offered to review the policies and provide feedback and input. So I think that's really positive. Throughout all of this process, my commitment continues to be that I will keep you informed and up to date. So there are now a large variety of options available to connect with your loved one. And while it's still not as easy as it was before, where you could just kind of come and go. There is virtual visits, window visits, outdoor visits, and now indoor visits. And I'm sure there'll be lots of questions, so we will come back and revisit this. Staffing levels remain stable, and we've been working hard to honor and support vacation requests. I'd like to shine a light on a group of staff who are part of the fabric of the home and are the unsung heroes in our defense against outbreaks. The housekeeping teams play a hugely important role. Not only do they provide clean and comfortable homes, they also provide safe homes, from the floors to the handrails, to the elevator buttons, to everything in between. And they do all of that while having and establishing friendly relationships and connections with the residents. So I wanted to just make sure I gave a shout out to that group of staff that are working so hard to keep everyone safe. Keeping residents up to date continues to be a priority, and up to date and involved in the changes and what's happening. And the teams in the homes are using the Ontario Association of Resident Council communication template to make sure we're not missing any of that communication opportunities. And there's been virtual family council meetings happening as well too, which is really great. Clinic Connects. This month, our homes are introducing Clinic Connects. It's a new communication tool through our electronic charting system, Point Click Care. This new program will allow the homes to send out important notifications via voice, text, or email, and you get to choose that, in a timely fashion, and will reach up to 2 resident contacts. Additional information is being mailed out with this month, the monthly invoices. And if you have any questions, please reach out to the business office. I would like to say this is a communication tool that will supplement the communication that we already do. So we'll continue to be doing the updates and newsletters via email through the subscription, the MailChimp subscription, and it will not replace the making a phone call and having a phone conversation with someone. So that is the update, and I am happy to answer any questions.
All right, it looks like we have a few in the chat, in the chat and Q&A section here. So the first one is regarding personal caregiver. Do you think a personal caregiver can return to work 30 hours per week? And would that person have to be tested every 2 weeks? So when do you think that might begin?
I'm thinking that's a hired support person, I'm thinking. So we're working through that. I think that person would fit the criteria of the designated care partner. It would fit that same definition. And yes, they would need to be tested every 2 weeks.
Okay. Jennifer, when tested for COVID-19, if you're asymptomatic, do you still need to isolate until you receive your results?
No, I meant to bring my little sheet up with me that they gave me when I went through the assessment center, and you just need to monitor for symptoms, self-monitor, but you don't need to self-isolate. And then do all of the things that we are all supposed to be doing when we're in the community, which is wearing a mask, physical distancing, good hand washing.
Thank you. So James has a comment here, and it's regarding our residents with dementia, and certainly they do have different levels of needs. I think it's probably fair to say that every resident in our homes probably does have their own varying level of what supports that they do need in place. James just makes some points around visiting and that being difficult in different locations, and that can be scary for residents with dementia. But it does sound like he is very hopeful about the designated care partners program. And I think, like probably other people on the call, is anxious to see this taking off. So I just wonder, could you just talk a little bit about this planning committee, how often they meet, and when we might see this being implemented?
Sure, and I appreciate that we've been talking about it for a long time, and that's not a bad thing. It takes some time to kind of get our brains wrapped around how do we do this safely, what does that look like, and it allows some time for feedback, but I appreciate that it feels like a long time. So partly some of the challenge has been waiting for the province to provide us directives. We're highly legislated and regulated in long-term care, and we wanted to be sure that we weren't kind of coming up with a workaround to the directives and going against the directives. So the update that came out on July 15th really supports that there's a difference between a visitor and an essential caregiver. And when you talk about providing support for a resident with dementia, that's different than visiting. That's providing care. That's being an essential caregiver. So now that we have that formalized as a definition and part of a policy from the province, it does allow us to move a little bit more quickly. So the committee, it's really the leadership teams. It's a representative from each of the leadership teams in each of the homes. And they're the leads for bringing back information back and forth from the home to myself and for us to plan the policy. There isn't programs like this already established in other long-term care homes for us to be able to borrow a policy and tweak it and revise it for us. So we've learned from some partners in the hospital sector, and hospitals are different than long-term care homes. And so we've taken and borrowed, they've shared their policies for caregivers and care partners. And we've taken those policies and needed to adapt them to fit the rules and restrictions in long-term care. And a lot of that work was happening while we kept waiting to hear what's the province going to tell us about visitors inside the home. So some of it we were guessing. We were pretty close in lots of ways. So the next step really is to finalize the policy, and we're very close. Public Health will have copies of the policy early next week. And once we have had our feedback and made any revisions necessary from Public Health's perspective, then we'll be able to get started on the pilot. The goal ultimately is that every resident will have their 2 DCPs, and we will have some system to safely introduce the eventually everyone will be able to have their DCP visiting, whether it might look like, let's say we've moved through the pilot and everything went well, and now we're opening it up that every resident can have one of their DCPs come and visit them in a week. It might be if the resident lives in a room that's an even number, their DCP comes on even days. If they live in an odd numbered room, they come on odd days. And that would allow us to have, we know then we would have only half the capacity of the home having a visitor at any one time. So we need to just work through that to make sure, can we support that? Is that safe? How much traffic is that in the home? We know everyone isn't going to be having a visit every day. And so we just kind of need to work through that. So I appreciate your patience. I know you can only hear soon so many times, but we're getting much closer, and I anticipate that, I'm just gonna look at a calendar, that by the beginning of August, we'll have the pilot underway.
All right, thank you, Jen. So we've had a few more come in here. So with retirement homes now allowing visitors into their homes for a few hours each day without testing required, why must visitors to nursing homes continue to have tests every 2 weeks for indoor visits? I don't know if that's one that you can answer, but do you know why there's a difference in the directives?
I don't. That's a provincial decision, and so no, I don't know why there's a difference.
Okay. So a Leigh Manor specific question. Do you know when there will be a hairdresser available for Leigh Manor?
I know that they are working through the process, and they do have, they have been providing hair services with a qualified member of their staff. So they are continuing to meet the needs of the residents. They have a qualified internal staff member, and at this time the salon is not open. And even though hair services have started, they're not happening in the salons necessarily. They're more happening in rooms.
So it was mentioned that perhaps in-room visits might be accommodated. For me personally, it would give the opportunity to go through clothing and essentials to see if they are adequate to meet the needs of the resident. So that, I guess, is more just of a statement. Tracy is wondering, how do we know when we can get the tests done? Now, I'm assuming that this is the COVID tests. So I will try to answer that, Jen. If you want to jump in, you can let me know. But there are various hours for the different testing centers around Grey County and outside of Grey County. So I would suggest that you do contact the center that is closest to you. If you go back to the emails that we've been sending, we do contain the information about of the assessment centers right on those emails. So hopefully that will give you what you need to get in touch. I think it's typically Monday to Friday now at these assessment centers, but please reach out to them or visit their websites and they should have the hours available there. When you went, Jen, maybe we'll hear your swab story. Did you have to make an appointment or anything, or did you walk in?
I did make an appointment. So I did go, I live in, on the edge of Grey County. So I live in Thornbury. So I did go to the Collingwood Assessment Center, but I believe that it's fairly similar to Grey Goose Health Services in Owen Sound. So I was able to make an appointment. I sent an email and they called me within half an hour and booked the appointment for the next day. And I drove to the assessment center. They confirmed my name and date of birth. And it was a drive-through assessment center. And I drove to the tent and the two nurses confirmed my name again and were lovely and told me that they told me what was going to happen and that it would be about 5 seconds of unpleasantness. And that's all it was. It wasn't painful. It was yucky. I'm not sure I'd like drive around to do it again, to do another loop that moment. But it wasn't awful. And the whole thing was less than 15 minutes from first arriving to driving out.
Thank you. If a piece of mail or a parcel, either by Canada Post Courier, arrives on a Friday, would they receive that the next day or would it wait until the Monday before it's received?
I'm thinking that they would get it the next day because there's people there providing service 7 days a week. So that's what I'm thinking. If you have a concern that that's not happening, then let me know or contact the home.
If one is designated a care partner, an essential caregiver, so a care partner, what are the rules and regulations regarding how many times one can visit their loved one?
So those are some of the details that we need to sort out during the pilot because we're just not, until we get people in the house trying it, I'm not sure. And I'm hoping for some feedback from public health, some recommendations. The provincial visiting guidelines are very vague and do not give us specific instructions other than make sure that you keep everyone safe. So I'm hopeful that public health will be able to provide us some recommendations on capacity and traffic and what is safe.
Okay, thank you. Will the two care partners have to be the same people ongoing, or can a care partner be substituted?
So if something comes up and someone needs to be substituted, we can work through that process. The idea is that it won't switch kind of every week, but if something comes up and there needs to be a substitution, then we would make that happen.
Okay. So a question here, it sounds like someone attended the home and are they to be questioned about COVID testing when they come for a visit?
That will be that should be one of the screening questions. So the screener will take your temperature and then ask you the series of questions. If that hasn't happened, it's a good reminder that I can take back to the teams that, you know, we get to know the people coming to visit, and maybe we get a little complacent and we can't do that. So I'll take that back.
Okay. And then just to provide some clarity on the different visitor status, the statuses that we've talked about, what type of visitor status allows the visitor into the residence room?
Okay. So I know it's who could have ever imagined that visiting could be so complicated. So there's the three levels of visitors. So there's the essential visitor, which is that kind of urgent crisis visit. So the easiest example is someone is at the end of their life. And so that is an essential visit. We have a policy for that, and the family members are contacted, and we make arrangements for in-room visiting to be at the bedside at the end of life. And then there's the other visiting right now, which is outdoor and indoor visiting, and that's physical distance, masked, hand hygiene, that type of thing. And then there's the pilot, which is the designated care partner. And the idea with that is that would be an in-room visit. And so the difference between a visitor and an essential caregiver or a designated care partner is that the designated care partner will be closer than the 6 feet. They won't be fit. They could be beside the resident. They could be holding the resident's hand.
Now, speaking of the outdoor visits and as well the indoor visits, or sorry, the window visits, are there any devices available that could help residents with hearing impairment hear? Some people are saying that it is difficult for the window and outdoor visits to hear, for their residents to hear.
Yeah, we can look to see if there's what we might be able to find. I believe that some visits are kind of like a window virtual visit combined. So it's the window visit and a phone on speakerphone on one side of the window and a phone on the other to help with that audio. So I'll take that back to the teams and see what we can come up with.
Great. Okay. So is it okay to get the test for the inside visit now, or do I wait?
So I think that have a look at the booking options. So go online and see what's available with your schedule, and then go from there. It takes 2 to 7 days to get your results. So you have to have your results back in order to do the visit. So I had my COVID test yesterday, partly because of everything we're doing within my work, and also because now I can go see my grandma, who I haven't seen since February. So I didn't book my visit with my grandma until later next week because I need to have my negative result back.
A question, do you think one visit a week is enough for a dementia resident?
No, I know, and I know that you can only hear that this sucks and it's hard on everyone so many times. Our hands they're tied, but we're working our way to find some solutions. So no, I don't think one visit a week is enough. But I know we can't support and don't have really the permission from the province to do more than that. But we're working towards it. And our goal is to get to a place where people that need more than one visit can get more than one visit.
Thank you. So there is the next question here that I'm seeing is, where do we go online to book a visit? So if I'll just get you to focus your attention over to the chat panel, I'm going to link the Grey County Long-Term Care webpage. So from this page, you can select the home that is applicable to you. And at the very top of the next page, you're going to see our booking form. And you know what? I'm going to try something here. All right, so this is the web page that I just linked you to. And if you go down to, we'll go to Grey Gables, it's first there. You'll see at the very top, we have our Grey Gables Color It Visits, and the link below is to the booking form. So you would click that through. This is where you would set in your preferences, and then you would pick your details and enter your name and submit. You can book that way. And I'm not sure if we have anybody calling in on the line tonight, but certainly if you don't have internet access, Jen, they can contact the home directly and someone will help them reserve their visit.
Yes, definitely.
Get back here.
I see lots of frustration about not being able to touch your person. So I do always take back the comments from these calls, and we talk as leadership teams about the comments. So thank you for sharing them. Noted, and I'll take these back and we'll talk to the teams and talk to public health and see what we can do. And the visiting is a top priority. James, I so appreciate your comments. I think every committee and every meeting that I'm a part of, they're starting to get tired of me talking about it, but we are advocating really hard for visiting to be balanced and safe, and really advocating for caregivers. And that's something that there's lots of advocating going on outside of long-term care for caregivers. Anybody living in a congregate setting is in this really tough, unfair position. And there's lots of work going on, and I'm reading every paper that comes out, every study that's happening, every chronic care hospital that's pretty close to long-term care, everything that they're doing to see what can we do to build this into long-term care and get going and get people in to see their loved ones.
Right. Comment from Kelly here says, my father was a resident of Leigh Manor and passed on July 1st. I'd like to publicly thank the staff for their support and kindness. It was greatly appreciated. Thank you. So thank you for sharing that, Kelly, and our condolences to you and your family.
So sorry.
Another comment here. Thank you for advocating for visiting. Our families need us and we need to be with them too. So I think that is being heard very loud and clear tonight.
I don't know if I mentioned it, but it's okay to say it again. The goal of the DCP program is so that we don't end up in this situation again. So in another wave, let's hope that there isn't, but if there's another wave of COVID and the community's locked down and everything shuts down, the goal is that the DCPs will not be excluded. So we may stop visiting, like the indoor visit, the separated visits with the table that are scheduled. We might stop those. But the DCPs, the essential caregivers, we might just turn the volume down. So have fewer visits, but not exclude people completely. And that's the goal, because if we work through this and we do it properly and safely, and we can demonstrate that it's successful, we can show that the DCP has been trained in PPE, just like the staff, trained in infection control, just like the staff. They screen, you're doing the testing. All of those things are the same things that the staff are doing. And if we have rules and commitments, like you go straight to the room and back and we manage the traffic, we would not need to then exclude people from the home, exclude you from the home. So that's the ultimate goal.
So a question here about the, so could we provide PPE for the DCP people?
Yeah, and we will. That'll be part of it. We'll be providing the PPE.
Excellent.
And I see Dale's comment, and that's what I was referencing about that kind of jump from outdoor visits to only distanced indoor visits and then in room. And so could there be something in between? So I'll take that back and see what we can do. What can we do in between?
All right, thank you. Just checking the chat here as well to see if there's any questions there. Again, if hospital patients can visit indoors daily, why can't nursing homes? Again, that's the directive. It's not, we really don't have insight into that. Really, all of us have a loved one in homes. We all hope they're kept safe and healthy during these trying times. Every moment counts. They're in their final home before they're in their final home before the final journey. All of this is difficult, and keeping all safe is key. I think that's very well put, Kimberly. Can mobile plexiglass stations be built instead of full face coverings for dementia patients? Is that anything we've ever looked into?
Mobile plexiglass stations. Oh, mobile, as in movable.
Yeah.
For the visit instead of full face covering. So I did inquire to public health about the face shields because they're clear and you can see them because they're clear. Oh, you'd think it was a Friday. And public health said that face shields alone cannot replace a surgical mask, unfortunately. I have seen on Facebook, so I have to look into the credibility, but I've seen face masks that are clear around the mouth. I want to look into that to see if that's useful. Does it meet the criteria of a surgical mask? Is that something that we could do? The other thing I've seen is this plastic that's kind of like a shower curtain, so it's kind of movable, and it would at least be a division where you could touch hands again, like at least you have the plastic in between you, but at least you can kind of touch. And then I've seen, I don't know where I saw it, but probably also social media, something where it was like the grandma hug and it was plastic, and then you were able to hug the person, but you had a plastic between you, which isn't ideal, but it's still better than 6 feet apart. So we'll look into those options to see if there's something that we can do at an indoor visit. So you're in a designated space, you know it's going to be cleaned, it's supported, and then maybe we have something where you could touch or the grandma hug. See what we can find.
Can someone book both an outdoor visit and an indoor visit in the same week?
I think that I'm getting that notice again about unstable internet. I think that we're hoping that every resident can have one kind of visit. If you'd like to do another visit in a week, call the home, talk to the program department, and they can let you know what their capacity is. If there was a bit of a time where some of the visits slowed down a little, and so there would be that opportunity to do more than one visit. So just contact the home.
Right. Ian is asking, my father was really appreciative of the visits by Grey County Museum staff. Will this continue?
Oh, that's so great. That's great feedback. And yes, I know that the other county department staff that were redeployed into long-term care, that, while they were glad to get back to their regular day job, I got such great feedback from them about how much they enjoyed the experience of being a part of that long-term care community. And there was lots of ideas bubbling out around museum and heritage and those kinds of opportunities.
Jane likes the mobile station idea, if that's something we can look into more.
Okay.
Another comment, I live in Saskatchewan and want to thank you and the staff for keeping our loved ones safe, as well as looking out for all the staff that are employed.
Thanks for that feedback.
If you have any more questions, you can type them in the chat here. Sorry, in the Q&A tab, please, if you have them. Jen, is the end of life the only essential visitor criteria? Is there any option for a severely agitated dementia client if it's felt that that would be very helpful?
Yes. So end of life is an example that everyone can kind of understand and relate to. So it's often the example we use for essential visitor. But there are other reasons for essential visits, and agitation, escalating responsive behaviors, depression, severe depression, things like loss of like not eating anymore. There was some times when everyone was eating in their own rooms and very little socialization was happening, that those were red flags that the staff were watching for and continue to watch for. And so those are other examples of when an essential visit could happen. And so if that's something that you'd like to explore, then contact the home. You can start with either the nursing leaders or recreation leaders.
Okay, so, and should they just call the main number for the home and go from there then? Yeah,
that would be good. I see a question about will a DCP be able to take their loved one outside? And so yeah, the goal is that in nice weather, there might be residents that have dementia and really enjoy going for walks, kind of wandering. And the safest way to do that would be outside. So that's one thing that we've talked about, being able to support. Another thing that a DCP might support is assisting with meals. So we're kind of working through what does that look like.
Is there any way for families to track if other members or other people are booking visits with their resident, just to make sure that they don't exceed the weekly limits?
I know, that's a really good question, and I don't have an answer to that. But when I called to book my grandma's visit, and she doesn't live in one of our 3 homes, they said, well, is any other family member coming that week? I said, I don't know. So I had to send a group email to say, I'm planning to go visit grandma and there's a second spot. So if you have your test, you're welcome to come with me. So we'll look into that. I don't know that I have I can't off the top of my head think of an easy solution to that, but we'll look into it.
Right. When your loved one can no longer Skype or come outdoors for a visit, what is the best option? What does one do?
If your loved one...
If they're no longer able to use the virtual visits through Skype and they can't get outdoors for a visit, what is the family best to do?
Right, so maybe an indoor visit would work. And again, for individual questions, it's a really good idea to phone the home. So the homes are, the volume of calls ebbs and flows, but do call. They're happy to talk through what the options are and what might work best, and find an option.
So are you seeing any more new ones in here, Jen?
I don't think so. I always wonder, are we going to have lots of questions till 8 o'clock to get us to 8 o'clock? And we do. I just want to say thank you for being so engaged in these calls. it's your feedback that helps us know whether are we on the right track. Do we need to redirect? None of this has been done before. We're figuring it out as we go along, and so we are not always going to get it right. Sometimes we're going to get it kind of wrong, and we need your feedback so that we can back up a little, redirect, and try another approach. And I really appreciate, and I know the teams do appreciate you walking through this process with us.
All right. Did you have any final comments tonight before we end the call?
Anything final? I always say the same thing. So I want to express my gratitude to the residents. They are resilient and supportive and understanding and give us lots of positivity. To you, the families, and I just mentioned that, but thank you. And of course, the staff who have been in this day in and day out for over 5 months, and they still come in with a smile on their face. They get their temperature, they put on their mask, they change their clothes and get to work. So thank you very much to everyone. And soon we can stop saying unprecedented times, because it's the next normal, and we just need to get somewhere that's balanced. So thank you, and please share your comments. If you weren't able to ask your question or you'd like to reach out, do so. And I'll keep you updated. Thanks so much.
All right. Thank you very much, everyone. Have a good evening.